So the functional medicine approach to acne, I guess what we're assessing is multiple things, because if you think of the skin as an organ of detoxification, which it is, like many other organs, then, and so I view it in that way. So I'm considering the health of the skin alongside all other systems of detoxification, such as the bowel and the liver and the lymph. And I often think of any skin condition, whether it be acne or any of them, as an imbalance in that detoxification process. That's one part of the functional medicine approach. Also, I don't think it's any coincidence that acne is a hormonal condition even in later years. It happens as soon as we go through puberty. So it is, consistent with a hormonal shift in our biology. But perhaps for some people that hormonal shift doesn't ever get corrected, or doesn't correct itself properly, or there could be genetic or familial tendencies, which there often are in families where there might be a particular kind of hormonal imbalance, such as polycystic ovarian syndrome. But it might not always be polycystic ovarian syndrome. There just can be other hormonal imbalances that you will see in families. And they might not always present either as acne. For example, one kind of hormonal imbalance is the enzymatic conversion of testosterone to 5-alpha-DHT, which is a really potent form of testosterone. That form of testosterone also causes premature balding. In men, it's indicated in prostate hyperplasia and prostate cancer, and also female pattern baldness. So even if there is an acne in the family, there might be other signs of a hormonal imbalance. So in terms of, I suppose that speaks to the type of assessment that happens in functional medicine consultations, is that we're not just looking at the individual, we're looking at their whole environment, including their own family, and what sorts of conditions and diseases are in their family history, not just their personal history. And because of the huge hormonal drive in acne, we do some fairly rigorous testing around that as well. So I use a particular kind of test that helps me not just work out what the gross amounts of progesterone, estrogen, and testosterone are. This test shows me how the body is metabolically dealing with it. And that happens through an enzymatic cascade. And so if one or some of those enzymes aren't functioning highly, it's going to cause essentially a backup further up the chain. And how that helps me then in treatment is that I can target that enzyme and have it work better. Or if I can't do that, I can help potentiate the metabolism of that hormone through another pathway. So that's part of the functional medicine approach as well. And ultimately the whole idea of that is to rebalance that hormonal system so that the hormones are no longer driving the incidence of the acne or causing the acne. So then what I also focus on though is skin integrity and skin health and innate immunity, because if Proprionis acnes is involved and is considered to be a localized infection in the skin, then we need to support the immune system to help resist that infection. So there can be certain nutrients like vitamin A, zinc, vitamin D that help the body support its immune response to that bacteria. The good thing about those kinds of nutrients though is that they're also involved heavily with tissue repair. So usually what a functional medicine approach will involve is addressing all of those different parts of the disease process. So optimizing detoxification through other systems and pathways, rebalancing hormones, and then also speeding up the skin healing time and reducing inflammation.